Immunization rates take a big hit in Oregon post-pandemic. Oregon Health Authority says while most parents immunize their school-age children to meet school requirements, since 2020, those rates have taken a steady turn. I spoke with one health official who tells us that the decline began even earlier, but at a slower pace, well before the pandemic. Though most parents choose to vaccinate their children for school in Oregon, exemption claims are rising.
The number of kids in kindergarten, which is where we measure this, who are claiming exemptions to one or more of the vaccine requirements has gone steadily up since about the year 2000. We had our highest level ever in the most recent school year, which is 23-24, up to 8.8% of kindergartners choosing an exemption to one or more of the required vaccines.
14 different vaccines built to fight diseases like the measles are recommended for children, and several should be received by 24 months old, like poliovirus.
Some of those diseases really are still out there. We had our biggest pertussis year, that's whooping cough, since 1950. Last year, we had our biggest measles outbreak since the early 1990s, more than 30 years. And it occurred exclusively among unvaccinated people. We had 31 cases.
Dr. Cieslak says many vaccines are live weakened strains of an actual virus and therefore not recommended for weaker immune systems. He blames vaccine fatigue along with taking medical advice from the internet for vaccine fears, but psychology could also be at play.
We think about the likelihood that a vaccine might work, or the likelihood that a child might have a side effect from a vaccine. But we also feel our way through these situations, and our emotional responses to vaccines actually can make a big difference. When you hear a story about some side effect that happens to a child, whether it's a true story or not a true story, just simply reading about those stories can actually make people more fearful about vaccinations.
Meg Olson with Oregon Families for Vaccines, a statewide parent-led initiative supporting childhood vaccinations, says her son was 6 months old when a measles outbreak happened in 2019. As a first-time mom, she worried because he was too young to be vaccinated.
There's a lot of misinformation out there about what some of the impact might be, or some faulty studies, but we all want to do what's best for our kids, and it can be really confusing to wade through that misinformation. We do know that vaccines are safe and effective.
As a new administration sets up shop in the White House, Olson says OFV is unsure parents will have access to vaccines.
Our immediate concern is about some of our federal programs that allow for families to access vaccines. Some of these programs could face severe threats. Some of these programs could go away entirely.
Parents of children in Oregon can claim an exemption from school immunizations for medical or non-medical reasons. OHA says School Exclusion Day is on February 19th. That's the third week in February of each year, where students without the required vaccinations for school or valid exemption are excluded from school.